We in the UK have seen a huge surge in prescription for GLP-1 agonists from people who are being prescribed for obesity and diabetes control, but also in my clinic, middle-class women who are getting access to GLP-1 to control their weight, who may not necessarily meet the criteria for obesity or diabetes. As a result, a rise in self-referral and clinical referral for body contouring and management of skin laxity. And quite interestingly, there was an article in the BBC this week, I don't know if anyone's seen it, about the problem where NHS prescribed GLP-1 resulting in weight loss and then ongoing skin laxity and patients being left without any support for the preceding skin laxity that occurs. There's rapid, large volume loss. We know that patients lose weight and we know they lose a lot of weight. I think last study, Mounjaro results in an 18% body weight reduction within 12 months of use. So this is significant weight loss that patients are experiencing. They also result in a loss of support. If you're losing subcutaneous fat, which is one of the biggest sources of the weight loss, you're going to lose dermal support. There is also growing anecdotal observed facial and body changes. Everyone's heard the term Ozempic face, and we're seeing patients with significant volume loss and also concurrently on a physiological level, loss of collagen and elastin. So potentially, we're seeing an iceberg where we're going to start seeing complications as a result of excess and rapid weight loss that these patients are going through. And hopefully this presentation will talk about how endermology can be of some assistance in this process. Many people are looking for alternatives to surgery. They want an evidence-based treatment option, and I believe that endermology will give them that. And it can be used very safely in conjunction with other modalities that you already have in clinics, such as lasers, radiofrequency microneedling, HIFU, ultrasound. Endermology, essentially, it causes mechanical stimulation. It is a system that uses motorized rollers and vacuum suction to stimulate and mechanically massage the skin. So the mechanical stimulation of skin and the subcutis has a direct impact on the fibroblasts, adipocytes, and lymphatic system, and it can ultimately improve circulation. It reduces fibrous septi tethering, hence cellulite, and helps to stimulate the extracellular matrix. Mechanotransduction is one of the largest modes of action. There's cyclical deformation, increasing fibroblast activation and increasing type 1 and 3 collagen synthesis and elastin expression. And we've got some really robust clinical studies that support this. And then finally, skin elasticity and fibroblast markers have been studied, and histological studies show, as well as imaging, show that fibroblast proliferation and improvement in skin elasticity. And so the take-home message with endermology is LPG is a non-invasive, low-risk treatment that can support body image during a very challenging phase of medical weight loss.